Hi.
Hello. Hello.
All right, nice. Okay, guys, here's what we've done so far this week. We've actually completed chapter 13, arthropod-borne diseases, soil-borne and arthropod-borne diseases. Today, I'm going to actually start, maybe even complete chapter 14. This is on STI, sexually transmitted infections, and STDs, sexually transmitted diseases, and then contact diseases. I want you to start thinking ahead. Your next exam is exam 3. And that includes 2 chapters, all right? So just to repeat myself from last time, that 2 chapters include chapter 13, soil-borne and arthropod-borne diseases, and then this chapter here, STIs and STDs. So tell you what, let me start my lecture. We'd have enough time later on to actually answer any questions that you might have. But again, I want you to start thinking about exam 3. It'll probably be 2 weeks from now. So I'll make my mind up totally on Monday and give you a definitive date. All right? Okay, so I have my objectives here for you. Of course, we're going to go through the lecture and we're going to fulfill each of these objectives. Before we start talking about diseases in particular, all right, I just want to go through a few stats for you. Now, a couple of things to keep in mind when we look at statistics, especially global statistics. The population of the planet is estimated to be just around 8 billion people, 7.8 billion people. This is as of January 2020, all right? The population of the United States, some people say it's 330, some people say it's 350 million people. So that's a lot of people, right? Now, every single day, basically, if you look at globally, about 1 million people actually acquire a STI. So let me distinguish between the terms STI and STDs. So STI stands for sexually transmitted infections. So someone can be transmitted, someone can have an infection but not show disease. So that's an infection, right? Remember there's a difference between infection and disease. Infection, there's an organism at a certain site in the body where it's not supposed to be. Doesn't mean to say it's causing disease. A disease is when, guess what, that quote, potential pathogen actually wins out in this battle between 2 individuals, yourself and that pathogen. And then what happens, of course, it proliferates. So in that case, you expect to have more infection than disease. So the numbers are not surprising, all right? The numbers are not surprising. You would have way more infections compared to disease. All right, hold on a second. I'm going to record this here. There we go. Okay. I think we're going. All right. So about 1 million people every day acquire an STI. Doesn't mean to say they have disease. In fact, most people tend to be asymptomatic. All right. Each year, about 500 million people, think about this, 500 million people. This is like 1 in about 15, 1 in 16 or so becomes ill with 4 STIs, 1 of 4 STIs. Chlamydia, top of the list, gonorrhea, and syphilis. Now, these 3 are caused by bacteria. In fact, I'm pretty sure you guys know them. Chlamydia trachomatis, that's a bacterium. Gonorrhea, we saw this name in the laboratory. Neisseria gonorrhea causes gonorrhea, and syphilis caused by Treponema pallidum. So these 3, they are bacterial in nature. The 4th one is trichomoniasis. It's the only parasite known to be transmitted sexually. That organism is Trichomonas vaginalis. About 530 million people have the virus that causes genital herpes. So when you think about herpes, you think about the genital form of the sexually transmitted forms. In fact, there are about 8 different herpes species that cause disease in humans, including chickenpox, by the way, Epstein-Barr virus, infectious mononucleosis, but we're not looking at that here. We're looking at the sexually transmitted form of herpes. This is HSV2, herpes simplex virus 2. More than 290 million people, women in particular, have the HPV infection. So HPV stands for human papillomavirus. So again, the point is this: we see quite a number of cases, right? Seem to be unbelievable, but especially this one here. Think about this: 531 in 16 people have been exposed or are infected with HSV, human herpes simplex virus. That's incredible. But the majority of STIs are present, of course, without symptoms. So people are infected, but they're not showing symptoms. All right. Now, this is maybe this map of the planet is several years old, but the statistics are relatively the same. So if you look at STIs in different regions of the planet, this is what we see in the Western Hemisphere, about 126 million cases. That's like 1 in 3 people in the United States. That's crazy, right? If you look at different areas of the world, Asia, Europe, 47 million, probably an underestimate because, again, most of these cases are present without symptoms. 93 million in the African continent. And you can read the numbers by yourself, so you can see it's a big problem, all right? We don't like to talk about these things too much because we like to kick it under the rug. It can be embarrassing, but it can be very lethal and very deadly, especially to kids, newborns who are born to mothers who have STDs. And again, even in an individual who has an STD, male and female, it can be quite critical. It can lead to sterility and a whole bunch of other complications, which we will study pretty soon, all right? Now, just consider syphilis alone. Every single year, we have about 305,000 fetuses, neonatal and fetal deaths due to this. Syphilis also leaves about 215,000 infants at increased risk from dying from a prematurity, low birth rate, or even congenital disease. So again, this is, by itself, syphilis is a huge problem. HPV, going back to human papillomavirus. All right, every single year, this is globally now, there's about 530,000 cases of cervical cancers. And every single year, about 275,000 people die. In the United States, that's less than 5,000. We see about maybe 15,000 cases of cervical cancer every year caused by HPV, right? But nonetheless, the death rate can be pretty high. Typically, when it's diagnosed, it's kind of late, it's already progressed to a later stage. So STIs such as gonorrhea, caused by Neisseria gonorrhea, and chlamydia, caused by chlamydia trachomatis, they are major causes of what we call PID, pelvic inflammatory disease. This is when the bacteria has grown into internal structures in the reproductive system. It can lead to infertility, can even lead to death, by the way. Hysterectomies and death, if it spreads pretty rapidly, all right? So again, we see this just based on the stats. STIs and STDs are a huge problem. Again, we don't like to talk about it, but it's a huge problem. I want you guys to think ahead. You guys will be nurses at some point, most of you, working in a clinic or in a hospital or the ER, for example. When patients come to you and you're seeing them, can you actually detect that just by looking at the symptoms? That's what I want to get through today, all right? So I'm going to talk about the major STDs, that being chlamydia, gonorrhea, and syphilis. And I'm going to talk about some other diseases that are transmitted sexually, but not as common as those three. All right? And again, in the United States, so we just focus on the global population. In the United States, this is what we're looking at. Every single year, we have about 20 million new infections. That's incredible. The total of people who have STIs, right, and STDs, 110 million people. This is check it out, it's 1/3 of the population, just about 30 to 33%. It costs about $16 billion just to take care of this problem, all right? Okay, and if you take a look at this, the proportion of new infections that are in people of this age group, 15 to 24, is 50%. This is 1 in 2, all right? And again, don't memorize these stats, but this is current statistics for the United States. HPV, this is new infections, 14 million. Chlamydia, 2.86, 2.9 million people. Trichomoniasis, about 1 million, okay? Gonorrhea, about 800,000. Genital herpes, about 776. This is new infections every year. And then, of course, HIV, about 40,000. HBV, this is a virus, this is the hepatitis B virus. That can be transmitted sexually also, about 19,000 cases, all right? So that's every year. But now let's take a look at other stats. This is existing infections. Other people have these infections. 79 million people. Think about that, just in the United States alone. 79 out of 350 million people. That's a lot of people who are infected with this, in this case, papillomavirus. And you can read this on your own. So HPV and genital herpes, they kind of top the list back here. Those are viral diseases. We're not talking about viruses yet. In fact, that's going to be the next chapter, chapter 15 to 15, 16, and 17. It's focused on viruses and viral diseases. But nonetheless, you can read through these statistics, and again, you can see it's a huge problem, all right? Okay, so when we look at bacterial STDs, we're not focusing on viruses. The top 3 on the list would be chlamydia, gonorrhea, and then syphilis, all right? If you take a look at the numbers, this is based on a more recent statistics. This is from 2018, about 2.4 million cases of chlamydia caused by chlamydia trachomatis, about 1.7 caused by Neisseria gonorrhea. And then for syphilis, what we're looking at, it's about just a little over 500,000 cases. So these are the top three: chlamydia, gonorrhea, and syphilis. All right? Okay, so before we get into the diseases themselves, of course, I want to do a little trick to help you understand the male reproductive system and the female reproductive system. If you've taken A&P, I know you've seen this before, right? But usually when we think about STDs, we think about maybe on surface areas, like for males, maybe the glans penis or the shaft of the penis and maybe the urethra. But again, things can take a bad turn. Those microorganisms can start climbing all the way up through the all the way to the urethra, get to the vas deferens, and end up over here in the epididymis. Now, that's a very serious infection. From the epididymis, infections can spread to the testes. That can lead to sterility, all right, and even death in some cases. So, the male reproductive system, you have the glans penis, you have the shaft of the penis, you have the urethra, you have the vas deferens, or ductus deferens as it's called, and then, of course, we have the epididymis and the testes itself. Now, of course, there are normal flora that you find at these sites, normal bacterial flora. And again, here's a list of them. We're not going to focus on these because generally they don't cause disease, but they do occupy sites and niches that help prevent disease. All right? We're going to focus on the prime candidates for STDs, not these. For the female reproductive system, you have the external female genitalia is called the vulva. And of course, most structures are internal, right? So again, you can have infection of the vaginal canal. You can have inflammation, it's called vaginitis. You can have an infection on the cervix itself. All right, so here's the cervix. This is the cervical opening. Here's the uterus. You can have infection in the uterus. When things get really, really bad, what happens? Those microorganisms can start climbing up the fallopian tube. That causes a condition called salpingitis. Don't worry about the terms. We're going to define them later on. But salpingitis is inflammation of the fallopian tube. So generally, it's confined in this area back here in the vaginal tract and the cervix. Then the infection actually progresses to disease. It causes painful symptoms in the patient. Patient sees the doctor, and then for bacteria, you can use antibiotics. For viruses, there are no cure for it. All right. Okay, so we have infections practically anywhere in this area. Of course, in females, you can also have urethritis caused by these pathogens also. That's inflammation of the urethra. So here's the bladder, and here's the urethra. All right? I want to point out a few things. In the vaginal tract, there are tons of bacteria. This one in particular, lactobacillus, we mentioned that to you before. That's a very important resident, normal resident of the vaginal tract. It's a good organism to have at that site. Why? Because it produces acids. It keeps the acid, the pH between 4.6 to about 6. That alone actually suppresses growth of potential pathogens, all right? But if you have a true pathogen like gonorrhea, Neisseria gonorrhea, or chlamydia, or even the organism causes syphilis, Treponema pallidum, it doesn't matter if lactobacillus is present or not. But in general, lactobacillus indicates, or a high concentration of lactobacillus indicates basically a normal vaginal flora. All right. Now, again, if you take a look at males, the urethra in males, we just kind of mentioned some normal flora. When we look at the female vaginal tract in particular, we have indigenous flora. These are normal. Again, I want to point out this one, lactobacillus, is a very important organism. Let me just say there are other defenses that people have in the vaginal tract. Lysozyme, you kind of saw that before. This is an enzyme that breaks down bacterial cell walls. You have it in tears, you have it in saliva, you have it in vaginal secretion. So it's an important enzyme. We have antibodies, IgG and IgA, also help with defense. There's a molecule called lactoferrin. This molecule actually picks up iron. Bacteria need iron, in particular, for their metabolism. So again, this helps in preventing growth of microorganisms, or I should say inhibiting growth of microorganisms. And of course, there's defensins. These are small molecules. Think about the term defensins. They help protect against bacterial infections. So I want to describe two terms for you, two clinical terms I'd like you to know. Vaginosis. This is when the normal flora, especially this one here, lactobacillus, is disrupted, whatever reason. Maybe a patient is on antibiotics, you start killing out normal flora. Maybe it's the time of the menstrual cycle, or maybe there are other underlying conditions. But when you disrupt that normal bacterial flora in the vaginal tract, you end up with something called vaginosis. All right? That can lead to vaginitis. So vaginitis is inflammation. Itis is inflammation of the vaginal canal, in this case, vaginitis. All right? Now, all that stuff, all the statistics, I just wanted you to pay attention to this. It's a huge problem. I said that to you before. What I want to focus now on is these specific diseases. All right, so I have the 5 top ones on the list. 3 of them are really important because we see them occurring most of the time. Chlamydia, gonorrhea, syphilis. All right. Then we have a disease called chancroid. And then another disease caused by chlamydia trachomatis also. It's called lymphogranuloma venerum, or LGV. So again, these tables are really helpful. It lists the disease, the causative agent. These are the names of the bacteria that cause disease, signs and symptoms for disease. All right. Transmission is primarily by sexual intercourse. There can be other mechanisms, but this is the primary transmission mode. I'm not too worried about treatment. That can change and that can vary. And of course, prevention is practicing safe sex or abstinence. All right. So these are the things I'd like you to know. And of course, in the slides, I'm going to show you other specific things I want you to associate with these different diseases. I would actually include a couple other organisms here in addition to what you see, but we see them very infrequently. So again, the point is this: the top 3: chlamydia, caused by chlamydia trachomatis; gonorrhea, caused by Neisseria gonorrhea; syphilis, caused by Treponema pallidum. All right? Okay, so let's go for the first one. The first on the list is the top bacterial STI, or STD. It's chlamydia urethritis, or chlamydia infection. The organism that causes this is chlamydia trachomatis. All right? Now, there are many different strains of chlamydia trachomatis, and they cause different diseases. The ones that we're looking at, as I mentioned to you before in this table, is D and K. So these are the major serotypes. Notice this. So this is chlamydia trachomatis. It causes the typical chlamydia that you hear about, the STD. There are other strains that cause LGV. That's lymphogranuloma venerum. And that's the L1 and L to L3 strains. And then there's another one that causes a disease called trachoma. This is an eye infection. We're not going to see this today. Probably see that on Monday as we finish up this chapter. But that's another chlamydia trachomatis strain. It's the ADC strains. All right, so keep in mind, different strains of the same organism can cause different diseases. Right? So let's go for the first one. The first one is chlamydia, caused by chlamydia trachomatis. I just want to point out a few things about the organism itself before we get to disease. So point number 1, chlamydia are obligate intracellular parasites. So what does that mean? Obligate is required. Intracellular, inside of a cell. Parasite, it infects something. In other words, it uses something to reproduce itself. So basically what this means is they require living cells to grow. All right? E. coli doesn't require that. Staph aureus doesn't require living cells to grow, but chlamydia does. You have to have an intact living cell for this organism to proliferate. So let's go. It has a life cycle. Let's go through the life cycle. When people are infected, this is what happens. So they have sexual intercourse in general. And what was the infective state of this pathogen? It is called an elementary body. All right. So this is what infects a recipient's cell. That bacterium gets into the cell. It starts replicating. So this is the infective stage, the elementary body. It starts replicating inside the cell. What you see inside of the cell is called reticulate bodies. This is not infectious. The reason why is because inside the cell. But at some point, it replicates so rapidly, all right, or I shouldn't say rapidly, to high numbers, that the cell lyses, it bursts. And what it does, it releases the infectious form or the elementary body. And of course, this causes infection. That cycle takes about 2 days to occur. All right. So I want to talk about the disease itself as it occurs in females and in males. And there's lots of writing here. What I'm trying to get across to you is the more common symptoms that we see. Right? So first of all, this disease, chlamydia, is called a silent epidemic in females. Here's the reason why. Most females, about 50 to 75%, and this can be as high as 90%, they tend to be asymptomatic initially. So they had sexual activity, the bacteria was transmitted to them, and they're not showing obvious signs of disease. So it's called a silent epidemic because they are asymptomatic to begin with. All right? More so than males. Males tend to be more symptomatic than females. Now, so basically with asymptomatic infections, Think about this. They don't know, these individuals don't know that they have the organism in there. They have sexual activity, so it's easy to spread this disease to other individuals. All right? Now, I'm going to talk about these terms by showing you pictures in a second. These are the complications we can see in individuals with chlamydia. Now, I'm going to show you some pictures. I want you to look at them. Here's why. You guys will be nurses, and at some point you will be seeing patients with STIs and STDs. And sometimes what you see as a symptom can actually help you identify what that person has, even just by looking, without further testing, even just by observing that those symptoms are the things that you see on a patient, all right? So common symptoms, this would apply, I don't want to repeat myself, but this applies to all STDs. For females, vaginal bleeding, a painful discharge, pain in the abdomen if it proceeds to, say, from something like salpingitis, which is inflammation of the fallopian tube, or PID, pelvic inflammatory disease. Fever, painful urination, painful sexual intercourse, all those things can apply to STIs and STDs. All right, but STDs. So let's go through each of these here, and we're going to put some terminologies to them, all right? And then some definitions to them. This is what you see when a person shows symptoms. Of course, what we're looking at is a female specimen. A device called a speculum has been inserted into the vaginal tract, and literally, you're looking at the cervix. So right here is the cervix. The cervical opening is right here. You can't see this because you see this fluid on it. So this is the discharge. Has a foul smell to it. It tends to be milky white. It's not very thick, and that's important because when we're going to look at that gonorrhea in a second, we see a very different characteristic of that discharge. All right? Okay, so this is what we see for a female specimen. You see that milky white discharge. You can see here in the female external genitalia, it's the same type of discharge. All right? Some conditions that we can see associated with this disease. First of all, salpingitis. Write that word down. All right? It should be S-A-L-P, salpingitis. In fact, I don't like the second time I saw this. Let me change that real fast. I don't like seeing errors on slides. All right, salpingitis. Come on. Let me do this. Joe. Card. Just so that you have it correct, Sal, S-A-L-P-I-N-G-I-T-I-S. Wow, that's so terrible. That's the correct word. Salpingitis. All right? That means inflammation of the fallopian tube. So here's what has happened. Are you guys still with me? Somebody say yes?
Yes.
All right, cool. Yeah, sometimes when I do this, things blank out on me. So again, what I'm talking about here is some conditions that you see with STDs. So we're looking at a female specimen, all right? And we're looking at conditions that can occur because of infection. So again, this person has sexual activity. Chlamydia trachomatis was deposited in the vaginal tract. That organism infected the cervix, and this is what we're looking at. That's the discharge. Now, sometimes that organism can grow to the cervical opening, get to the uterus, and then start growing up in the fallopian tube. That condition is called salpingitis, all right? So salpingitis, itis again is inflammation. This is inflammation of the fallopian tube. Now, if it becomes pretty extensive, so the fallopian tubes are infected and then the ovaries are infected, we have a different condition. In fact, it's even worse. That condition is called PID, pelvic inflammatory disease. All right, so PID, the whole pelvic area, it's inflamed. And again, in serious cases, that leads to hysterectomy. It can even lead to death in a patient. So something that's, I don't want to say simple, but could be easily treated to begin with, it's allowed to proliferate, and now we have a way bigger problem, all right? So salpingitis, it's inflammation of the fallopian tube. Pelvic inflammatory disease, or PID, it's inflammation of the pelvic area, all right? Conjunctivitis, people touch their eyes, they might have that pathogen on their hand because they touch their genitals or whatever. Now you have infection of the eye. So this is what you see. This is conjunctivitis. Babies who are born to mothers who have STDs, in this case is chlamydia, have something called ophthalmia, refers to the eye, neonatorum. This is newborn, all right? So this is infection of the eye for newborns. So take a look at this because I don't want to compare this condition to what we see for gonorrhea. So again, we see infection of the eye or inflammation of the conjunctiva. So that can also occur. So we have PID, salpingitis, conjunctivitis, other things that can occur, ectopic pregnancies. So ectopic pregnancy simply means this is development of the fetus outside of the uterus. So here's what normally happens. A sperm unites with the egg like right over here. This is the upper third of the fallopian tube. But in the case where a person has this type of infection that results in salpingitis, what you're doing, you're messing with that tube. Literally, you're distorting that tube. It's being degraded. It's not a smooth passageway anyway, so that fertilized egg cannot make its way down to where it needs to be in the uterus. So basically, fertilization occurs right over here, and then fetal development occurs. That's ectopic pregnancy. So simply stated, ectopic pregnancy is simply this. It's development of an embryo and a fetus outside of the uterus. All right? Again, that's by the way, babies have been born, healthy babies, ectopic pregnancy, but most of the time it's so painful that it's removed surgically. All right? Now, other conditions that we see, people practice all forms of sexual activity, oral, anal, rectal. So again, we can see this pathogen or lesions in the anal or rectal area. In some cases, especially newborns. So these are babies born to mothers who have chlamydia. We can see pneumonia. Kind of unusual for an STD, but a baby can have pneumonia. Again, so you can just tell by looking at just the pictures, these are awful conditions. The good thing, if there's anything good about this, is that these can be treated, all right? So bacterial STDs can be treated with antibiotics. Viral STDs like herpes, once a person has that, or HPV, you have it for a lifetime, all right? I mean, that disease itself. All right, so this is males. Males tend to be more symptomatic. About 50% of males are initially asymptomatic. And again, because they're asymptomatic, they can transmit this disease to other individuals without knowing it. But again, you see the same type of discharge, that milky white, off-white colored discharge. And again, look at the discharge pretty well because we're going to compare this to gonorrhea in a second. All right, it can be clear, it can be milky. In this case, what happens, the male has lesions, so this is caused by chlamydia, on the glans penis and then on the shaft of the penis. And this other case, what happens, that bacteria grew all the way down to the epididymis. So I pointed out the basic anatomy earlier. So now we have infection of the epididymis. This is where sperm is stored. And of course, that can slip into the testes itself, all right? In this case, we have infection of the oral cavity. So again, typically we see this in homosexual men or people who with anal lesions or rectal lesions or oral lesions. Tend to be more common in homosexual men, but females can also get these types of infections in those regions because of this type of sexual practices people engage in. All right. So with the epididymis inflamed, that's called epididymitis. Inflammation of the epididymis can be caused by many different organisms, but STD, the ones that cause STDs are more common. All right. Okay, so there are many tests we can do to actually identify the presence of this organism. It's not something I'm too concerned with for this class. So you can look at them, but I'm not going to test you on the test that we do to identify the pathogen. Right? Now, next on the list, remember, chlamydia is the #1 bacterial STD in this country. Next on the list is gonorrhea. So you guys all know this, the name. In fact, we talked about this in the laboratory, and I mentioned it a couple of times already in lectures, previous lectures. So what causes gonorrhea? It's a gram-negative cocci, and the name of the organism is Neisseria gonorrhea. There are several different types of colloquial terms for it. It's called a clap. That stands for clapois, which means brothel. So hopefully that's self-explanatory to you. So the organism, it's a gram-negative cocci. Here's a gram stain. You can see the organism here, the gram-negative cocci. They look like little kidney beans. So it's a diplococci, two organisms or two cells that are stuck together. As the cell replicates, it's like little kidney beans. I can draw that a little better back here. This is what it looks like, all right? So those are diplococci. This is a white blood cell, in case you're wondering. That's a neutrophil. Neutrophils, they come by and they chew up the bacterial cells. So here's a neutrophil picking up that organism to destroy it. All right? Okay, so again, the organism is transmitted among humans. Humans are the reservoirs for Neisseria gonorrhea. Doesn't survive too long outside of the body. We see the highest number of cases between 19 to 29 years old. All right, it's estimated out there that we have about 3 to 4 million people who have gonorrhea, except again, most people, about 50% at least, tend to be asymptomatic to begin with. So there are more cases than that's reported, of course. So males, they tend to be more symptomatic than females, again, because they have external structures. For females, it's about 50% asymptomatic and 50% they report some symptoms initially, vaginitis, inflammation of the vaginal canal. All right. Okay, so in females, again, we have things that you can expect, just like we saw for chlamydia. If this goes on, if this is not taken care of, the organisms can keep growing all the way to the fallopian tube. Remember that salpingitis, right? You can have pelvic inflammatory disease where the internal structures are infected. That can lead to ectopic pregnancies, as we saw before, possible sterility. In males, there's tingling of the penis, there's painful urination, there's a penile discharge, and I showed you that's pretty thick. Now, I asked you to look at what you see for chlamydia and compare that to what we see for Neisseria gonorrhea. So this is a male specimen, of course. You can see a very thick, yellowish, whitish, purulent discharge. Purulent is because it has white blood cells. Pus, in other words. Pus refers to the presence of white blood cells. So that's pretty thick. We see the same thing oozing from the cervix of a female here with gonorrhea. So let me go back to the previous slides. This is what we see for chlamydia. Right, milky white, kind of liquidy, foul smelling. This is what we see right here again for the male with chlamydia. All right, now take a look at the one for gonorrhea. For gonorrhea, it's a thick, purulent discharge. So both males and females. All right. For males, I mentioned epididymitis. This is inflamed epididymis caused by Neisseria gonorrhea. All right, so here's normal. So what this looks like, and here's an inflamed epididymis. What happened? The bacteria grew from the urethra all the way down to the vas deferens, and it ended up in the epididymis. All right, so just some terminologies. Urethritis, inflammation of the urethra. Itis against inflammation of urethra. All right. Epididymitis is inflammation of the epididymis. So, of course, that's males. Females don't have epididymis. They don't store sperm, right? Prostatitis, females don't have prostate glands. So this is, of course, this is in males. Itis, inflammation of the prostate gland. Anorectal gonorrhea. Again, we see this in people who have anal intercourse. So that's not so uncommon, by the way. GC stands for gonorrhea. All right, or gonococcus. It's the same thing. If you see this term, GC or gonococcus, it refers to Neisseria gonorrhea. Pharyngitis, people who practice oral sex. Just imagine somebody has gonorrhea. You know what can happen. So here's an individual who has oral or gonococcal pharyngitis. And then, of course, conjunctivitis. Again, primarily in kids, babies in particular, born to mothers who have gonorrhea. So just like we saw with chlamydia, this is ophthalmia neonatorum. This is an infection in the eye in newborns. All right, so conjunctivitis. Notice this again. You see that discharge, similar to what I showed you from right here, right? So this is a penile discharge. This is a cervical discharge. This is a discharge from the eyes of a baby who has gonorrhea, Neisseria gonorrhea in the eye. Now notice, take a look again at the symptoms. That's what I'm showing you. This is gonorrhea. And what we see back here, this is chlamydia. All right, so we see very different symptoms. All right, different discharges. All right, there's something called DGI, stands for disseminated gonococcal infection. So basically, the bacteria can leave a local site, like in the genital tract, and then move to other sites. That's not so uncommon either. So in this case, you have an infection here on the foot. In this case, back here, you have in the joint. So basically, the bacteria gain way all the way to the synovial fluid. Now, this is kind of unusual. Again, most cases are confined to the genital region. So you have inflammation because of the presence of the organism in synovial fluid. All right? And then there are tests that we do to actually identify the presence of this organism. The only thing I want to focus on, oops. Actually, I don't have that test here. All right. But I want to just tell you this. It's easy to do a gram stain. So we saw this before when we looked at gram stains, initially with, I think it was chapter 3, that's a few weeks ago, because this is what you would see. Right, when you do a gram stain, you can see from that exudate, from the discharge that I showed you, you see gram-negative cocci inside or outside white blood cells. So it's easy to detect. And of course, it's easy to culture this organism in the laboratory. It takes about 2 or 3 days. It takes a while for it to grow, but unlike chlamydia that you can culture routinely, this one can grow relatively easy in the lab. All right. Now, next on the list, it's syphilis. Syphilis, of course, is caused by a spirochete. And again, I know you guys know this because we talked about this in the lecture, but also in the laboratory. So these are the organisms that look like a corkscrew. All right, that's a spirochete. Treponema pallidum is the name of that organism. And I want to talk about this disease from 3 different perspectives, 3 different stages of the disease. So again, you can read all of that stuff here. But people who have syphilis, they can progress through, the disease can progress through one of 3 stages. So primary, secondary, tertiary, and the latent stage, basically this is after the first year of infection. All right, there are 2 forms, early and late. But really, this is what I'm going to focus on here. So let's go through this disease. So the first stage is called primary syphilis. It's characterized by this, and don't forget it's called a hard canker. This is what it looks like. It's on the penis, you can see that lesion. That's a hard canker right there. All right. This is on the female external genitalia. All right. This is on the lips. You can see several different lesions. Well, actually, about 3 or 4 lesions back here. This is on the shaft of the penis. You can see another lesion right over here. This is on the labia majora, female, of course. You can see a lesion. This is on the tongue. All right, yeah, on the tongue. This is in the anal area. You can see lesions here, and this is on the finger. All right. So each lesion is induced by Treponema pallidum. Those are called hard chancre. It's the primary stage, the first stage of this disease. That's what you see. Basically, this is where the organism Treponema pallidum invaded tissues. All right. So again, people describe this as being painless, although I can't imagine that. So it tends to be circular. There's fluid in there. If you take a needle and pop this, it seeps of fluid. That fluid is just teeming with this organism, Treponema pallidum, so it's highly infectious. All right. Now, this can occur in a matter of weeks, 1, 2, 3 weeks, but as maybe as long as 10 to 90 days. So it can take a while before you actually see this lesion flowing. Now, many times this lesion heals on its own, and basically the infection stops at this point. But you can't take the chance to say, the patient's cured. The best time to treat a disease is in the primary stage. So here's a good example. Penicillin still works for this against Treponema pallidum. It's a very good drug unless people are allergic to penicillin, which can happen, by the way. So here's an individual who has been treated with penicillin. This is a week of treatment. Basically, a couple of shots of penicillin. This is what you see. That person heals pretty well. All right. Here's what can happen if you don't treat. That organism can enter the bloodstream and hide out in your organs. And then we have a very different condition. So point number 1, primary syphilis is characterized by something called a hard canker. That has a fluid. It's a clear fluid. It's that canker seeps a clear fluid that contains the pathogen, highly infectious. All right. Best time to treat is during this stage of that disease. All right. What's going to happen in between this time or during this time is the bacteria can actually invade tissues. And now you have secondary syphilis. So this can occur several weeks or several months later. So just like we saw for another spirochete disease, if you go back to Lyme disease, right, we had the first stage of Lyme disease, then we have the second and third stage, similar consequence here. That bacteria penetrates into the bloodstream, and then it goes to different sites. So this is what you're going to see. This is what characterizes secondary syphilis. This copper-colored skin rash. You can see several different examples back here. It can be anywhere on the body, the soles of the feet, the palms of the hand, but it can be anywhere in the body. And this is on the tongue, all right? So this is the rash that we see. All right? Okay, so again, the most important characteristic you see for secondary syphilis is this copper-colored skin rash. The liver can be involved. In that case, people can have jaundice because of poor liver function. All right? So as the months and years pass by, people enter what's known as tertiary syphilis. This is late-stage syphilis. Again, this can occur several years, even decades after initial infection. Why? The bacteria is still present in the body. You haven't wiped it out with antibiotics. And keep in mind, the bacteria can replicate very slowly, but you're destroying tissues over time. So how is this manifested? Well, there are several different things we see in people with tertiary syphilis. All right? Gammatysyphilis. So this is an example. In this case, this is a gamma right here. It can occur in external areas, so that's quite visible to you. But it can turn viscerally also. In other words, in internal organs. Here's the liver with a gamma. All right? Here's the upper jaw, the palate with a gamma. What gammas are, these are lesions in which elastic tissues, that's connective tissue now, is weakened or destroyed. There's also a weakening of blood vessels. So with gammatysyphilis, it's one of the most important things that we see in individuals with tertiary syphilis. About 15% of the cases are gammas. All right? There's also something called neurosyphilis, and that makes sense. Neuro refers to this, in this case, neurons. This is the central nervous system, and you can see lesions here in the brain. All right, so you have major tissue destruction in the brain. That can lead to a whole bunch of different conditions. Meningitis, for example, seizures, dementia, blindness, loss of hearing, things that are related to the central nervous system. And then, of course, we can have invasion of the heart and the blood vessels. So we have cardiovascular syphilis. About 10% of cases end up like this. The point is this. The best time to treat this disease, any disease, is in the primary stage because you have very few organisms, relatively speaking. The organisms haven't gone systemic yet. In other words, they're not invading organs like you see back here. But still, even though people have not been treated in the primary stage, if you figure out that person has syphilis, either second stage or tertiary syphilis, you can still treat them with penicillin, right? I want to focus on congenital syphilis. Congenital simply means that you're born with a condition. Babies who are born to mothers who have syphilis, and maybe they have syphilis on their own too because they acquire that bacterium during development. When they're born, they demonstrate this. This is called snuffles. It's also called syphilis or syphilitic rhinitis. Rhino refers to the nose. This is inflammation of the nose or nasal passages. That's called sniffles. It's kind of indicative of congenital syphilis. There's another condition. It's called Hutchinson's triad. All right. So triad means three different things that we're looking at. These individuals have interstitial keratitis. So in this case, you have destruction of the cornea of the eye. So these are babies who are born with destruction of the cornea of the eye. That's called interstitial keratitis. Teeth abnormalities, I can never understand this one, but as they grow and develop, they have abnormal teeth. And if you read old textbook, it says peg-shaped teeth. This is a condition that we see. It's one of the conditions for Hutchinson's triad. And of course, the central nervous system is affected. So we see conditions that are linked to that. In this case, it's deafness, all right? So again, with congenital syphilis, you see snuffles. That's an indication of a patient has syphilis. It's also called syphilitic rhinitis. And then we have the Hutchinson's triad, interstitial keratitis, teeth abnormalities, and then finally deafness. By the way, babies have been born, babies, you have stillbirth for many babies who have syphilis, all right? Now, as far as screening for this, don't worry about this slide here. That's not for you. But I do want to talk about the classic way we screen for syphilis to tell if a patient has syphilis. Keep in mind, we can't culture this organism. For years, people have been trying to culture this in the laboratory. You can't culture it, right? So you rely on serological tests. In other words, blood tests to tell if you have antibodies to this organism. So one test is called VDRL. All right, so it's right here, VDRL. It stands for Venereal Disease Research Laboratory Test. Here's what this test entails. People who have syphilis, they make antibodies, all right? But those antibodies can also, against the organism, but those antibodies can also react to this. This is called cardiolipin. So when people have syphilis, they're producing antibodies. Antibodies can actually react with something called cardiolipin. So you can get cardiolipin from an external source. So that's what the companies make. You can collect blood on a patient, get the serum, and mix it with cardiolipin. This is what you would see under the microscope. All right, this is non-reactive. what happens, the antibodies bind to cardiolipin, and it forms these little reactive spots here. This is called a fluctuation test. You have these little clumps that form. Now you see this under the microscope. All right, so that's the VDRL test. What I want you to know is antibodies from a patient with syphilis reacts with something called cardiolipin. The VDRL test requires a microscope to see these little clumps that form. Now, several decades ago, people got a little wiser, and basically they said, you know what, we can do the same test, but except I wouldn't need a microscope. What they did, they added charcoal to their reagents. And again, this is what the test is like. See, basically it's the same test. Antibodies react against cardiolipin, but no, you don't need a microscope to see it. You can visually see this without the assistance of a microscope. This is called the RPR test, Rapid Plasma Reagent Test, RPR VDRL test. All right? Okay, so those are the two tests I'd like you to know. VDRL, and then a modification of the VDRL is called the RPR, Rapid Plasma Reagent Test. Okay, so those are the three major pathogens. Don't worry about this. These are the different stages. These are how these tests turn out, positive or negative, or plus or minus, but that's not full. All right, so those are the three most important bacterial pathogens. Top of the list, of course, it's Chlamydia trachomatis. Second is Neisseria gonorrhea. And third is the organism that causes syphilis, or Treponema pallidum. I want to backtrack just a little bit because I do want to point out one thing to you with gonorrhea. All right, again, I don't ask you to memorize treatments. When you guys work as nurses, you're going to be learning this when you go through nursing school, you'll be learning about this in pharmacology. And again, the treatments can change. But I do want to point out one thing. Many strains of Neisseria gonorrhea are called PPNG strains. Don't forget that term, PPNG. What does that stand for? Now, check it out. We learned about antibiotics in chapter 10. That's several weeks ago. We talked about a huge class of antibiotics called beta-lactams. And remember, penicillin is an example of a beta-lactam antibiotic. PPNG strains of Neisseria gonorrhea, here's what they do. They produce this enzyme, penicillinase. It's also called beta-lactamase, but nonetheless, it's penicillinase. It's an enzyme that destroys penicillin. So again, Neisseria gonorrhea, that are classified as PPNG strains, they're resistant to beta-lactams. They're resistant to penicillins, in other words. Remember we talked about sex pili conjugation too? Well, the story goes like this. Before 1976, most strains of Neisseria gonorrhea, they were sensitive to penicillin. 2 shots of penicillin would do the job. All right? After 1976, what happens? Most strains, a strain of Neisseria gonorrhea, acquired a plasmid. This should ring a bell to you. A plasmid that contains a gene, right? That contains a gene that codes for this enzyme, penicillinase. So again, this enzyme allows the organism to be resistant to beta-lactams, especially penicillin. So you don't use penicillins to treat gonorrhea anymore. Why? Because it's expected that most strains would be resistant to that antibiotic. All right. I want to move on to a few other organisms. I'm just going to do a brief survey of them. Those are the 3 most important ones, and then we're done for the day. We'll continue with this again on Monday. All right? So organism number 4 causes a disease called chancroid or soft chancre. All right? Remember when we talked about syphilis, we said the primary stage would be characterized by something called a hard canker. In this case, we're looking at a soft canker. This disease is called chancroid. Very, very rare in the United States. Typically, when we see it, people have traveled to other countries, engaged in sexual activity, and now they come back with this disease. All right? The organism that causes soft chancre or chancroid is a gram-negative rod, Coccobacilli. In other words, it's really a gram-negative rod, but it can look like a spherical organism too. So this is what it looks like. That organism is called Haemophilus ducreyi. All right? So soft chancre is caused by Haemophilus ducreyi. Typically, this is what you see. Again, if you try to compare this with syphilis, the primary chancre that you see with syphilis doesn't look anything like it at all. So these look more like blisters. Contains blood in there. Very painful. People describe this as being very painful. And if you pop it, it doesn't seep just a clear fluid. It seeps blood. Highly infectious. All right. Good thing we don't see this one too often in this country. Think about this. Generally speaking, in 2012, there were only 15 recorded cases. The number has increased a little bit, but nothing in the thousands by any means. So it's a very rare infection and disease that we see, right? Now, next on the list is a disease called LGV. Stands for lymphogranuloma venereum. Remember, this is caused by chlamydia trachomatis, right? So I showed you that table before. If you go back to the first page or the first few slides, this is caused by chlamydia trachomatis, but a different strain that causes the typical chlamydia infection. And again, what I want to point out here is just the name of the organism. Very few cases relative to chlamydia and syphilis and then gonorrhea, about 1,000 cases per year. And this is what you see for LGV, right? So this is lymphogranuloma venereum. Here's the female external genitalia. You can see inflammation. You can see inflamed lymph nodes. So lympho, think about this, lymphogranuloma. So there are granulomas, or swelling or inflammation of lymph nodes. And then you can see this on the shaft of the penis also. And then you can see these lesions here on the female external genitalia. That's called the vulva, all right? It's described as a very painful disease, but again, very, very infrequent here in the United States. Now, we're winding down with STDs. Next on the list is granuloma inguinale. So what do I want you to know about this? You don't have to memorize all these facts for us. It's a very rare condition we see in the United States, about 100 cases per year, all right? So what causes this disease? It's a gram-negative blood. It's called Klebsiella granulomatis, right here. That's the name of the organism. Take a look at the ulcers that you see. These are the ulcers or the lesions that you see can be anywhere in the genital area, the perineal area. This here, the glands are swollen, all right, pretty highly infectious. This is the female genitalia external, all right, and this is the organism present in a macrophage. That is called a Donovan body, all right, so the bacteria present in white blood cells, you see these little inclusions here, that is called a Donovan body. This is in a macrophage. So again, another name for this disease is Donovanosis. This named after the guy who actually described this, all right? So again, granuloma inguinale, very rare in the United States. It's caused by Klebsiella granulomatis. Another name for the disease, it's Donovanosis. Is it widespread? No, not in this country. You see fewer than 100 cases per year, all right? Now, another disease that can be sexually transmitted, but generally it's not. But we do have to talk about it because it causes non-specific vaginitis in females. That organism is Gardnerella vaginalis, all right? So this is a gram-variable organism. It can be gram-positive, gram-negative. It's truly a gram-negative organism. So terminology for you, vaginitis, this is inflammation of the vaginal canal. Non-gonococcal, this refers to Neisseria gonorrhea. So every time you see this word GC, all right, GC, think gonococcal. So what organisms are we looking at? Neisseria gonorrhea. All right, so it's non-gonococcal urethritis or non-specific vaginitis. In other words, it's not caused by Neisseria gonorrhea. Now, this organism, Gardnerella vaginalis, post-puberty, most females, if not all, actually have this organism in the vaginal tract. So it can be, quote, normal flora in the vaginal canal. But here's what happens. Remember we talked about lactobacillus earlier. Imagine if I have a normal population of lactobacillus. Typically, this is what it looks like. Lots of lactobacillus species. This is normal. But for whatever reason, maybe the menstrual cycle, or maybe people are on antibiotics, you start wiping out lactobacillus and that dips. What we see happening is other organisms can actually increase in numbers. All right? So Candida albicans that causes yeast infection, that's a fungal disease in females. Candida albicans levels can rise, but in this case, we're looking at non-specific vaginitis caused by Gardnerella vaginalis. As lactobacillus numbers decline, guess what happens? Gardnerella vaginalis numbers incline. So this is increasing over time. If I have an overpopulation, here's the thing. If the vaginal tract is overpopulated with Gardnerella vaginalis, then this can occur. Vaginosis is just an imbalance of that flora, but now that can lead to, you have a ton of growth of Gardnerella vaginalis, that can lead to non-specific vaginitis. So this is what you see. That discharge is similar to what we see for chlamydia. If you recall, all right, foul smelling, but this is caused by Gardnerella vaginalis. Now, I want you to remember this term, a clue cell. Here's a clue cell. Let me tell you what a clue cell is. Normally, in the vaginal tract, epithelial cells are sloughed off. All right? So those cells are sloughed off, and then they're removed from the system. All right? If you look at a typical normal gram stain of a specimen from the vaginal tract, this is what you would see. This is lactobacillus. That's a gram-positive rod. And then you see tons of epithelial cells too, but that's normal. That doesn't look anything like this. This is a clue cell. So here's what we have. We have an epithelial cell on which is stuck this organism, Gardnerella vaginalis. So basically, this organism, G. vaginalis, can stick pretty tightly to the surface of epithelial cells. That is called a clue cell. Why do we call it a clue cell? It gives you a clue, in other words, that what's causing that problem, vaginosis or vaginitis, or this what you see here, this cervical discharge, what's causing this problem is Gardnerella vaginalis. All right, so that's called a clue cell. So if you see on an exam clue cell, the very first thing you're going to think about is Gardnerella vaginalis. All right.
I have a question.
Yeah, go for it.
So for number 7, the nonspecific and then the gonococcal, is that associated with sexual transmission at all?
Can be. We listed on here. Generally, it's not. And that's a very good question you asked. People still debate whether this is a true pathogen. So imagine here's a male having sex with someone who has this condition caused by Gardnerella vaginalis, right? So here's a male engaging in sexual activity with this individual who has this. And then that male engages in sexual activity with another female. All right? You see how that can be transmitted sexually. But in general, here's what happens. We just have an explosion in the growth of this organism in females where the lactobacillus population decreased. So basically, there's an imbalance of normal flora. That's called vaginosis. We actually defined that earlier in today's lecture. So vaginosis is where you have an imbalance now, an abnormal situation, where that normal population of bacteria is not what it should be. Most likely what happens, lactobacillus levels decline. When that happens, other organisms can pick up. If it just happens to be this one, Gardnerella vaginalis, which is present there already, can be normal flora, except it's too much growth now with this organism. You can now have this condition called nonspecific vaginitis or non-gonococcal. In other words, it's not caused by Neisseria gonorrhea. So yes, to answer your question, it can be transmitted sexually, all right, but generally speaking, it occurs in that individual herself. Why? It's because you have an explosion in growth of this organism. All right?
Thank you.
All right, nice. Other questions on that? Are we good?
I actually have a question about chlamydia.
Yeah, go for it.
On this slide, it had 2 different percentages about how many are asymptomatic. So I just
so I had like 85 and 90. It just depends on the study.
Yeah.
But generally speaking, if you look at most records, it's between 50 to 75.
Okay.
But nonetheless, so the point is most individuals are asymptomatic to begin with.
Okay, thank you.
All right, that's a good observation. But it just depends on the study. Yeah?
I think there might be a couple slides missing from the PowerPoint you posted on Blackboard. For instance, I didn't have the slide that talked about PP&G.
Yeah.
That's missing from the PowerPoint that you posted.
You have it. Is it missing?
Yeah, that slide particularly is not on. Well, for me, it's not on this. The one
it's there. He just went back.
Oh yeah. So I said, in fact, I said, hey guys, I forgot to say something with gonorrhea. If you go back to the slide where it talks about the types of medicines you take, the antibiotics you take, if you look at the bottom of that slide, all right, you're going to see this here. All right. In any case, I'm going to post this lecture. Are we good?
Okay, thank you.
All right, cool. All right, so guys, let me finish up this STD section, and I want to talk about the last group of organisms that can be transmitted sexually. Again, it doesn't have to be a sexual transmission, but it can be transmitted sexually also. I just want to mention the names of 2 groups of organisms, Mycoplasma and Ureaplasma. So these are genera. There are many different species like Mycoplasma hominis, Mycoplasma genitalium, and Uriplasma urolithicum. And parvum, those are the most common ones. But what I want to point out, these are kind of unusual organisms because they lack cell walls. So remember, cell walls are very important for bacteria to survive in the environment. So it's very difficult to culture these organisms. And also, that's one thing. The second thing is this. Remember, since they lack cell walls, we can't use beta-lactams. Because things like penicillin, if you recall from the antibiotic lecture, right? Think about all the beta-lactams, penicillin, cephalosporins, monobactams, and carbapenems. They are all beta-lactam antibiotics. We can't use that because those antibiotics attack the enzymes that make cell walls. Well, these organisms don't have cell walls, so we can't use penicillin. We use other drugs like tetracycline. All right? Okay, so those are the organisms that cause STD. Remember, the top three would be Chlamydia trachomatis, Neisseria gonorrhea, and Treponema pallidum that causes syphilis. The others, they do occur, but we see very few cases, relatively speaking, very few cases compared to the three major ones. All right? Okay, so I'm going to stop here. And I'm going to continue with this lecture on Monday. In fact, on Monday, we're going to finalize this lecture. I will post a lecture on viruses. We probably would not start that on Monday. We're going to start that on Wednesday. All right? So we're going to have a clean cut next Monday where we have all the information that's required for exam 3. And I just want to remind you, start studying, right? 2 chapters only. Chapters 13, which is soil-borne and arthropod-borne diseases, and then this chapter which we'll be finishing up there on Monday. This is on STDs, bacterial STDs, and then, of course, contact diseases, which is what we're going to be talking about next. Are we good? You guys have any questions for me? There will be a quiz on Monday. It's going to be based on everything we've just talked about, the STDs, in other words. All right?
When did you say the exam was again?
So on Monday, I'm going to make a definitive plan. So I'd like to give you guys at least a week's notice. So I'm thinking that exam will be the following Monday or Wednesday. All right? But I'll tell you for sure on Monday.
The quiz is going to be on the last chapter and then up to this point on this chapter, correct?
It's just going to be on this chapter, STDs.
Okay, thank you.
All right? Are we good?
See you next week, Professor.
Okay, Tay, have a good one. Have a good weekend. Study. The exams come around real fast. All right, I'll see you guys in a bit.
I have
Other
a
questions I can
question.
answer. Yeah, go for it.
So the quiz on Monday, is that just this chapter and not at all chapter 13?
That's right. So as I said, it's only on bacterial STDs.
Okay, thank you.
All right. Other questions I can answer? All right, guys, have a good weekend. Study hard. That exam's going to come pretty fast before you know it. All right, so be well prepared for that. I'll see you guys on Monday.